Hi, my name is Lisa Ferrero. I live in Northern California near a town called Sacramento. This is my journey with amyloidosis and multiple myeloma. I've been going through this for the last 10 years. I experienced a very quick diagnosis, which is unusual with this disease, and I feel blessed to be here today to tell you my experience with Nexella and their CAR T-cell clinical trial. 10 years ago, I started having symptoms after a bout of pneumonia that I'd never had before. My legs were so tight I could barely walk. I had to elevate my feet due to ankle swelling. My tongue was swollen. I would get, it's called purpura around my eyes, purple. And I had various symptoms, and so the doctor ran some tests. Next thing I know, I'm at an allergist, and then I'm at the rheumatologist. And then the scary word, I was sent to a hematologist and oncologist. I didn't quite know how to take that. I was extremely scared. And after much more testing and biopsies, they determined I had a form of multiple myeloma in what they called the MGUS stage. And then more tests showed it was in the smoldering myeloma stage. And then it became full-blown myeloma after a bone marrow biopsy showed my plasma cell dyscrasia percentage was very high. So about 6 months later, I underwent a stem cell transplant at UC Davis in Sacramento. And I was in the hospital for about 14 days, a very traumatic experience. Lost all my hair, lost my sense of taste, and lost all my energy that I used to have to get up and do things. It was it was painful. It was long, drawn out. It took me a good year to recover. I had to go back to trying to work out and to build back my energy and physical fitness. Before the stem cell transplant, I had tried the traditional therapy called Cyborg-D, which includes a steroid, dexamethasone. My stem cell transplant, to be off the steroids is a miracle for me. During those 10 years, after the stem cell transplant, which only worked for 6 months, I regressed and my light chain numbers started to increase again. So we had tried, I believe it's 10 lines of chemotherapy treatment. Immunosuppressants, proteasome inhibitors, you name it. I did all of them on the list. They lasted about, maybe 9 to 10 months each. And then I get the blood test results that, oh no, they're back up again, so we'd have to change strategies. And last couple of years, my last chemotherapy was the worst. Felt like I had the stomach flu 4 days out of the week, and then I had 3 days of rest. And I used to cry taking the medicine because I thought this is what I have to look forward to. I was in the hospital for 17 days, begging them to let me out at 14 or so. But I understood why they wanted to just monitor me. They were very diligent in all of the steps being carried out for our safety and for their trial information. Since being home, the first 6 months were tough, only in the sense that I was just tired. My body was trying to recover and accept these new cells. They had taken my T cells, and basically, in a layman's term, they took those T cells and put bullets in them, put them back in my body, and they're in there fighting the fight. And that's a lot of work on your body. And so I just had to realize that, and if I needed to take a nap, I took a nap. It's been 8 months, and I'm so thrilled with the change in my life. It's been amazing, and to me, it's been life-saving and so rewarding. I would encourage anybody in this situation to investigate and see if this is what's right for you. We have 2 people now on the West Coast that would be, may not be here without having this treatment, and that was Carl and myself. And Today I'm getting back to feeling like I'm not sick, which is something, I haven't felt for a very, very long time. I still have amyloid in my system because this is not, this doesn't take care of the deposition of that in your body, but it shut down the factory. So I'm no longer producing the bad protein cells, and my body can start to heal. And we'll see where this takes us. Thank you.
Hi, my name is Dave. I'm Lisa Ferrero's husband, and I guess what we're here to tell you is that it's been a long, strange trip that we've been on over the last 10 years. I think part of it was because of the nature of the condition, AL amyloidosis, at the time that Lisa was diagnosed, was something that was not very widely known or very well understood. So as a result, it took quite a bit for us to get through the initial part of trials, well, not trials, but the tests she had to go through, the diagnoses, the various different treatments that were attempted, and there was quite a bit. There really was quite a bit. None of them ever lasted very long, unfortunately, and so from one time or another, there was one cocktail, treatment that was administered, and it would last for a little while, and then there was another one, and none of them ever seemed to be, doing the job that we had really hoped for. The stem cell transplant was quite unpleasant, and it really put a heavy burden on her. It was very difficult to deal with. But the CAR T cell, the Nexella treatment that we went through, was diametrically opposed to it. That couldn't have really have been any better. The team that organized this was fantastic. They were right on top of it the whole time. And having a single point of contact for all the things that had to be arranged and choreographed was really very good. It really was. It's as good an outcome as we could have hoped for. She has no sign of disease, and like I said, it's really as good as it could have been. I don't know, I don't know what more I can say about it, really. You've got a lot of technical detail from some of the others that were here, so you don't need me to go through it all again. I think they covered it pretty well. I just want to express the fact that while with any kind of a treatment, with any kind of drug, with any kind of medical procedure, there's always the potential side effects and the potential effects that people can have, and everybody reacts a little bit differently. But the experience that we've had going through this has been fantastic. None of them has been all that difficult to deal with, and we're all handled in a very, very quickly and very thorough manner. So I haven't been burdened by this, but I've seen the burden that has been put on the people that have, and this has been a tremendous blessing, this therapy that's come about, and we're eternally grateful for the genius that has been bestowed upon the people that have organized this and come up with this treatment and figured out how to make it work. It's been fantastic. So if anybody is wondering whether this is right for them, I would say don't let yourself be burdened by this disease any longer than you have to. It's been fantastic, and you definitely should do it. Thank you.
Very happy to be here today to tell you my story. I believe I was the first patient in the Western U.S. to take part in the Nexella 201 clinical trial for the treatment of amyloidosis. This occurred in early January of this year, 2025. My story starts in 2001 when I was injured my sternoclavicular joint when a goat pulled on a rope I was holding. I had a cortisone injection in the joint, and things didn't heal well. I had all kinds of tests done, and it was determined that I had a staph infection. But also during the test, I learned that I had MGUS, which is monoclonal gammopathy of undetermined significance, a real mouthful, which is a precursor of multiple myeloma. At the time, I saw an oncologist, but there were no symptoms. Everything was just smoldering, or it was just MGUS, and there was nothing to be done except to follow. I saw my GP on a yearly basis and had some tests done, and everything seemed to be under control. In early 2000, I started getting black eyes with little or no provocation. One time, a sneezing fit caused just a terrible case of black eyes, and I saw my GP and several ophthalmologists, and there was no diagnosis. Nobody could figure out what was going on. I finally searched the internet and found a condition called raccoon eyes, and the description fit my conditions perfectly. The raccoon eyes are called by amyloid being deposited in the eyelids. I insisted on an eyelid biopsy, which indeed proved positive for amyloid. I was diagnosed with smoldering IgG kappa myeloma and amyloidosis. A battery of tests showed no bone lesions or major organ involvement, except for the eyelids. At about the same time, I developed a hoarse voice and had some scopes done on my vocal cords, but there was no sign of amyloid there. So I may or may not have amyloid in my vocal cords. A bone marrow biopsy showed 15% plasma cells, and the FISH study showed deletion 1p, deletion 17p, and several other abnormalities. Very soon I started chemotherapy with the standard starting treatment, daratumumab, cyclophosphamide, and bortezomib. This lasted about 4 months and resulted in a partial response, and then it plateaued. A second round of chemo followed with elotuzumab and lenalidomide. This lasted 5 months and resulted in only a minor response. In May of 2001, I started my third treatment regimen with carfilzomab and pomalidomide. This lasted several months. Again, the response was marginal, and I elected to try a stem cell transplant, which was done at UC San Francisco. After about 5 months, it was decided I should restart the carfilzomab regimen, which continued until August of 2023, when I experienced shortness of breath while walking. Subsequent tests showed severe blockage and that I needed bypass surgery. It is thought that the heart problem had nothing to do with amyloidosis or chemotherapy. My recovery went well, and I was off of chemo for over a year. Eventually, my kappa lambda ratio started to creep up, and something needed to be done. All this time, I had no symptoms except for the black eyes, which occurred approximately monthly and lasted 7 to 10 days. At this point, I was told I learned of the Nexilla clinical study. I had to decide whether to go back on carfilzomab, which seemed to be helping, or to go for the CAR T. I had been experiencing some neuropathy for several years, but only in my feet and only at night. I decided that chemotherapy might be the cause. The idea of a drug that could get me off of chemotherapy made the decision easy to go for the NXC-201. I'd also heard good results from a study in Israel that was working very well. There were a lot of requirements to qualify for the study, but it seemed my case fit all the requirements, so I decided to do it. After a slew of tests in late 2024, I was ready, and on January 10th of this year was admitted to the hospital at UC Davis. A week before, my white blood cells were removed from my blood and sent to a lab where they were genetically altered using the NXC-201 drug. And so the cells were trained to, or altered to better attack and attach to my diseased plasma cells, which were making the amyloid. That was followed by lymphodepletion using cyclophosphamide and fludarabine to reduce the number of remaining T cells and suppress my immune system. My genetically altered T cells were then returned to my bloodstream, where they immediately went to work duplicating themselves and attacking my diseased plasma cells. I experienced a very mild case of cytokine release syndrome with just a slight elevated temperature, for which I was administered a drug. The problem was quickly resolved. I was in the hospital for a total of 15 days. This not fun, but I got a lot of walking done in the halls. I got a lot of played a lot of Scrabble with my wife. 1 week after the procedure, my kappa went from 50 to 6.3, and 12 days later, it was down to 0.6. Today, my kappa is nearly in the middle of the normal range at 13. My lambda is in the normal range at 10.4, and my ratio is in the normal range at 1.24. There's no M spike to be detected, and my bone marrow biopsies are looking good with no sign of disease. In August, my IgG dropped below 400, so I had 2 infusions to bring the number back up, but seems to have stabilized in the high 400s now. My hemoglobin has remained low in the 9 to 10 range, but I've recently started iron supplements. My black eyes still appear occasionally, and my waxy amyloid can still be seen in my eyelids, but I see constant improvement. It takes a very long time for the amyloid to disappear. Overall, I consider the procedure a smashing success. I feel great with just mild neuropathy and tender eyelids. I look forward to a good life free of chemotherapy. It's been almost a year now. The testing is less frequent, and in 2 weeks, my wife and I will drive our motor home to Arizona for for several months of fun in the sun. This would not have been possible had it not been for my CAR T cell transplant. And I give my thanks to Nexella, UC Davis, and to my wife, Kathy, who made hundreds of appointments and arrangements. Couldn't have done it without her. Thank you.